Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Learning to Trust Your Body Again, Healing the Hidden Wounds of Medical Training. Jessie, welcome back to the show.
Thanks. Happy to be here.
All right. What's this latest article about?
This article is about learning to trust your body again. And the backstory is that recently, last year, 20 years after having been in the ICU a couple of times as a pediatrician mom with two young kids, I went back to work with a personal trainer to try to do the physical therapy that I never did
Hmm.
because I was too busy. And what I've learned from this experience is literally that so many of those ways that I approach things, like just sacrificing myself and not listening to my body, have actually become literally like a part of my cells and a part of the way that I move. And as I've worked with this amazing person, I have started to realize that it's like a body untraining. And so while I showed up because I was gonna get stronger. I'm in my mid 50s, when you're in menopause, you're supposed to build that muscle and eat your protein. And I thought, well, I need to do this so I don't break down. And it ended up being this totally different experience than I expected. And I think for so many of us in medicine, we don't listen to our bodies. We
Yeah.
don't even know how. And it made me really start to think about all of this sort of hidden curriculum of medicine and what we've learned, and that these wounds from way, way, way back are still here 30 years later. And what happens if we don't tend to them?
So I definitely hear you, and I'm sure a lot of physicians listening to you now can relate with that because medicine is rooted in self-sacrifice, right? And when they say self-care, self-care often comes last. Now, I think that you, I'm sure, talk to so many different physician clients. Just give us a sense of what kind of examples have you heard? What kind of stories have you heard about physicians sacrificing themselves physically and having them come to regret that later on? What kind of stories have you heard?
I mean, really, I'll just say awful stories.
Yeah.
And so many physicians. I mean, I used to think it was uncommon to be a physician who ended up in the ICU in your 30s. It's actually not that uncommon.
Mm,
And I think a huge part of my story was that I just didn't take the time to go in, and I waited and waited and waited and waited because there was no time. And I see this where people defer preventive care, they get cancer. There was that recent article about how women live longer than men, except in medicine.
hmm
And you just see so much autoimmune disease and also just catastrophic, life-changing medical issues from one, neglect, and two, from the system itself. So from the lack of sleep and from, not being able to use the restroom and from the sort of just intense ongoing levels of stress and fight or flight. So interesting because we tell our patients, right? We would never tell them to do things like
Yeah.
that. We know they're harmful. And yet we do them to ourselves and almost glorify them when people don't take time off. I actually scheduled somewhat emergent surgery at the end of a day, and I worked all day and didn't eat because I was like, well, I need to be NPO, so I'll just go at 5 p.m. And that makes no sense at all,
hmm
right? It was not an elective surgery. But this thought that, like, I just thought that was normal. And then you start to recognize that it's not normal when you see other people do it. So what might seem not normal is incredibly normal in the lived physician experience.
And why is it that medicine as a culture, why do we normalize things that in pretty much any other field it'd be considered extreme?
Well, such a good question. So this is my personal opinion. I actually don't know why. It's our
Yeah.
culture, right? So it's just essentially been carried on from a time when medicine was very different. And so I think to me it's a carryover. And then we've become very attached to it. It's all we know. And so we have this fear that if we don't do it, that something bad will happen. I often liken it a bit to a cult, and I say that somewhat facetiously and also true, that the idea is if we step out of line, we'll get in trouble or something bad will
hmm
happen, or we'll be kicked out. And so we all sort of line up and keep doing it. And then it's actually what we know. And even if we're uncomfortable with it, we expect it for ourselves and we expect it for our colleagues. So even if you change, your colleagues expected.
Yeah.
I remember actually being in a car accident on the way to work, and my boss said, "Well, could you come this afternoon?" And I ended up actually having quite a few injuries, and I couldn't go back to work for 3 months. But that was the first response was, can you, okay,
Yeah.
we'll reschedule your morning because obviously you can't get here, but could you show up this afternoon? And it's not that anyone has an intent to harm. It's just the culture we've set up. It's a little bit like we don't know any different. I think about work hours and same story, right? Those of us who did it, which I was in the era of before work
Hmm.
hours, we thought it was normal. And so then we're like, well, what happens if the next generation doesn't have all that learning? Something terrible will happen. But it's really just a matter of what we don't know and perpetuating a culture. I think that culture also works really well for systems. And so we would have to redesign our systems, and
Yeah.
that's a big project.
Of course, like a lot of systems rely on people who
Yeah.
self-sacrifice and
Yeah.
kind of work until they literally die, right?
Yes.
So it's
Yeah.
it's no wonder that systems would want to prefer the status quo.
I think it also, I'm just thinking we're trained in this way to not listen to our bodies, so we also don't even know how.
Yeah.
And so part of it is that by the time we start having these issues, we don't even see them. We don't notice them. We just think pain is normal. We just aren't attuned to listening. And so I think once you start listening or something hits you over the head, then things really shift. And that's what I see happening a lot in medicine these days. And this work that I have started to do, I had no idea how impactful this was on my body and the way that I carry my body and all of these old injuries and things that are layered upon
Yeah.
layers. And I think that I was never taught how to listen. In fact, I was taught to not listen.
Hmm.
It's the exact opposite. I was a competitive athlete as a child, which I think many people who go into medicine were.
Hmm.
And so we're also taught there not to listen. And so it becomes this very familiar echo. And when you start to listen, it's pretty phenomenal what you realize you have done to yourself. And
Yeah.
I think what we expect others to do themselves. And that's where we can change what we expect of ourselves. We can change what we expect of others as well.
So you've been on the show multiple times. You've written a lot of articles on Kevin MD talking about balance and work and burnout. Have you noticed any changes over the last few years? Has it gotten better from your experience and the clients that you're seeing?
I think it's gotten better on a personal level. So, physicians themselves and people working in medicine themselves beginning to set boundaries and recognize the harm they're doing to themselves, right?
Hmm.
We took an oath to do no harm. What hasn't gotten better is the systems
Yeah.
matching. And I think that that is beginning to follow with the so many people leaving medicine and it being so hard to replace. But I don't think that the tide has shifted yet because there's still many a physician who say, well, I can't let down my colleagues, so I'll work double time, triple time because we don't have the staff. And that's sort of the crisis that we're in right now. And the
Hmm.
story of right now, not enough money in medicine and all the political and economic changes. And so it's still going back to this way of,
Hmm.
we have to do this in order to keep the system afloat or in order to take care of our patients. And so it's shifting, but incredibly slowly.
And when you say the system, it isn't just like the hospital system and our medical systems, but we're talking about medical education as well, because the culture of medicine gets ingrained from the very beginning, right? So the medical education system has to change as well.
Right. And I think that we're taught, I mean, very beginning of med school, right? When you can, sleep when you can. If you don't get any sleep, that's actually you're learning more.
Hmm.
And you can't take time off practically even for a death in the family. And so that becomes the norm. And when you are in training, you're very susceptible to cultural patterns and what people tell you, and you feel very vulnerable. And so that becomes just sealed in this time of trauma, and then we carry it forth. So, yes, it has to change the whole way. And the systems have to change, but we also have to change what we expect of ourselves and what we expect of others. And I think to me, it's really with compassion
Hmm.
because when I get angry, like, oh, why did I do that? Or why didn't I do this physical therapy for 20 years? And why haven't I, learned to trust myself and the cues? And that doesn't help you change, and it doesn't help you have compassion for yourself or others. And yet, generally in medicine, we're terrible at
Yeah.
self-compassion. So getting ourselves out of this is also a dilemma because of the ways that we were trained.
So, what kind of advice do you have for physicians to push back against the system that prefers the status quo? How do you have physicians listen to their bodies? And sometimes that's in tension, like you mentioned in your story, with administrators who expect them to persevere through bodily injury.
I think as you ask that question, it has to start with you. Because if you don't feel strong within yourself and you don't trust yourself, it's really hard to advocate effectively.
Hmm.
And so that's what I think the message of this whole personal training journey for me was, is that, well, I thought I was pretty strong at it because I've been working at this a long time. If you recognize that the wounds are not just in your brain in the way you think, but they're really somatic as well, and really working on all of those. So taking care of your nervous
Hmm.
system so that when you advocate, you're standing tall and the tone and energy you bring to the conversation is very steady and grounded. Because when we advocate from a place of fear, like physiologic fear, which I think many of us, when we try to negotiate or we try to be persuasive about why this is unreasonable, we're in a more reactive pattern. And so I think it actually does have to start with you. And it has to start with working on your own body and
Hmm.
making your own changes and standing tall and using also just legal tools behind you. I remember being on a California Medical Association wellness committee, and they wanted us to decide whether it was okay for residents to take 6 months, 6 weeks leave after having a baby. And legally in California, that's you're disabled
Hmm.
for 6 weeks. And so I think sometimes using those kinds of laws to sort of say like, well, this isn't really a choice. You're actually like within the system
Hmm.
deemed disabled. So we shouldn't be asking people who are disabled to be at work. And we shouldn't say that this human is exempt from that, but all other humans are not. So sometimes leaning into those things. But if you don't feel safe yourself, it's very hard to advocate. That's why it's so hard for residents in particular, right? Because they're not actually safe.
Hmm.
They're vulnerable to the whole system and they are need promotions and they need passing and they need all of these things. So we really do have to start with ourselves and then with yourself. If you feel safe and whole, it's much easier to advocate for others. So, for example, if you were a leader and you took care of yourself first,
Hmm.
you can model changing the system. But I think it's a lot to ask for people to just go advocate and yell and fight back, which actually we've seen hasn't worked, honestly.
So this should be an obvious question, but I suspect it isn't for a lot of physicians.
Yeah.
Tell us the type of signs and symptoms they should observe in their own bodies to make them realize that, hey, I may be doing some irreparable harm physically to myself.
Yeah. I would actually start with checking in with your body on a regular basis so you actually know what it feels like. Because what I have found is so many of people who are trained in medicine have no idea how they feel.
Yeah.
Whether they feel good, happy, sad, like they're completely numb to the feelings. And in fact, when I was trained, you weren't supposed to feel things, right? You were supposed to feel sad. You were empathy, okay, but you weren't supposed to have grief reactions to things. And so just this practicing in more neutral moments about how you feel so that you actually are once again in tune with your body. I also think mindfulness helps you have a sense of if just like you can do things like a body scan where you begin to get to know your body again, because then you'll notice the cues that things are off.
Hmm.
And then the other thing I'll say, which I see a lot, and this was me with that whole ICU experience, if you're asking your colleagues, like, what do you think this is? What do you think I should do? You should go see a doctor and be in an exam room and
Hmm.
allow yourself to be a patient. I think we think that that is weak. But if anything doesn't feel right, I think as a physician, you should trust it. We don't. We're like, well, maybe it's fine. Maybe I don't want to know. And I think we know the system so integrally that we really don't want to know. And so just to honor that if you're picking up anything, it's actually very likely something. And that you should have a much lower bar of entry into the medical system than anybody else because our level of sensitivity and judgment is literally off when it comes to our own health and our own signs and symptoms. And I think often people, I hear today especially, labeling it as burnout.
Hmm.
And when it's not burnout, it's actually a physical issue. And people, physicians will come to coaching and very often it's a mental health issue. And so it's like, wait a minute, make sure that you're not just sort of judging yourself and thinking this is something you can mindset your way out of. I always say get the physical checked out first
Hmm.
to make sure you're not missing something really significant. And get your own health care. I think we tell people about healthcare all the time. And one of the tools I think is so helpful is hearing what you say to patients and apply it to yourself. So if you're telling people they should get their screenings 50 times a day, just take a moment and say, oh, am I due for anything? And treating yourself as well and taking as good care of yourself as well is critically important because we're acting like professional athletes in medicine
Yeah.
these days. We actually need more care and we need to prevent injury and prevent illness and prevent these long-term issues if we can.
We're talking to Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Learning to Trust Your Body Again, Healing the Hidden Wounds of Medical Training. Jesse, let's end with some take-home messages that you want to leave with the Kevin MD audience.
The first one is to show up with compassion. Don't be mean to yourself about whatever you haven't done or deferred maintenance, and honor that it's hard to take care of yourself. And the next one is just to listen. So if there's anything, remember your Richter scale is completely different than everyone else's, and get to the help and support that you would want for your patients.
Jesse, as always, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
My pleasure.